guys, Callum from the Foot Clinic here. So in this video we're going to talk a little bit about what assessments and tests might be performed in clinic to see if children have any problems with their feet, or if there's anything that could possibly be done to ensure that they grow and develop normally as they're growing up. So just like with adults, the kids' feet come in all shapes and sizes, and how they should be looking and operating does change very much, of course, but in a very short amount of time compared to an adult. So rather than taking years for things to effectively develop and fall apart, things can happen sometimes in years, months, if not even weeks, that can make a huge difference as to what needs to be done to keep their foot in a healthy state. So things that we look for, first of all, is actually just taking a look at the history and how a child was in pregnancy, how it was during birthing, if there was packing issues or complications during birth, and of course what the weight was. And then from there, making sure they've hit all their milestones. So when were they crawling, when were they walking, talking? These are all things that can be linked definitely to developmental issues, especially when it comes to things like walking and crawling in regards to the feet. Next is general checkup of skin and nails. Again, as with adults, we're looking out for things like skin infections, but also in children, especially young babies and toddlers, there's sometimes skin conditions like eczema and psoriasis, which may or may not last until the long term, but can also be confused for other conditions like tinea sometimes. In terms of shoes, these are probably the biggest things that really causes problems for everyone, but especially for kids, as we've talked about previously, things like wearing shoes that are too tight because there's been fast growth, wearing shoes that are too big because parents are hoping to accommodate some space for growth there, or just hand-me-down sort of pattern, which we do see less of these days, but still happens. And also then understanding of what is a good shoe. And that's actually something that changes depending on if you're dealing with a toddler versus if you're dealing with a teenager, of course. And these have to be considered when you're also looking at obviously the type of foot we're dealing with. So shoes are very important to look at, and there's not a lot of education out there for what actually makes a good shoe, especially for a child. Following on from that, foot posture and shape. So we're talking really everywhere hip down, from the knees to the ankles to the feet and toes. Not even just talking about flat foot to high arch, but even things like toes curling in or out, or knees being knocked together or not. All these things, very normal to see in variation. Not everyone's born with perfect, straight, nicely set foot, but ideally these should, yes, develop over time, and at different stages you expect to see different deformities that would eventually grow out, but that's something that of course can be assessed in clinic as to whether this is matching the child's age and stage of development. Moving on from that, joint flexibility and muscle testing. So children are pretty flexible for the most part, but as we said, this actually does reduce ideally over time to the point where they do have some solidity. So when they're getting into heavy activity, they're not always rolling their ankles and falling over. In connection to this, the strength of the muscles should also be developing proportionately. Now, some kids aren't always the most active, or they're active in very specific activities, and these muscles can be underdeveloped. So checking for that in clinic by just doing some strength testing and resistance work and moving joints through their range of motion pretty much lets us know if anything is underdeveloped or sometimes overdone and needs to be worked, built up, or in the case of flexibility, if it's something's too tight and there's a bony restriction, possibly we need to actually be looking at some more intense measures like surgery to correct those bony problems. Coming up close again is walking style, or as we call it, gait. So definitely the way a child walks, of course, the difference between a 1-year-old, a 3-year-old and a 7-year-old is going to be gigantic. But again, matching with milestones is very important for us to make sure that the way they're moving is in key with their stage of development. And as we talked about previously, things like toe walking and in-toeing, fine to see at certain ages, but you want to see that develop out as we get older, okay? And then finally, reflex testing. So from your older doctor's knee knock to the flick to things that we do that might not seem obvious to test for, such as reflex testing on a baby's palm and seeing if they flare up or down. All these sorts of tests and more we can do to really make sure that the neurological aspects, so from the brain down to the spine and everything affecting the body, is really developing at the right rate. So these are really actually key tests, which are big red flags if they're not meeting as expected, and can even possibly require us to then on-refer for further investigation. So all these and a few more things are really important things to look at, really for a lot of adults, but especially for children in their stage of development. These are things you can keep your eye out for too, and if you think you notice anything wrong, don't be afraid to get it checked out deeper. Until next time, guys, keep on walking.